Our emergency department sees over 80,000 patients every year. We are a primary stroke and a STEMI receiving center, so we do a lot of care for this community. Cardiac monitors are super important for emergency patients. They're not just used for chest pain patients or cardiac patients. Someone can come in with abdominal pain or shoulder pain, and we put them on the cardiac monitor, and we don't realize when they walk in the door that they're having a cardiac event until we put them on the monitor.
When patients are having active heart issues, unstable angina, heart attack, congestive heart failure, they end up having lots of irregular heart rhythms, and if they are not caught on time, the consequences can be deadly.
My wife had a heart attack. When I brought her over here into the hospital, when they got her into the hospital, I was sitting with her down in the ER, and all of a sudden, a whole bunch of people came to my wife's bedside. I said, "What's going on?" They said, well, according to the monitors, your wife's heart isn't doing what it should be, and we want to make sure that we're here and get this straightened around. That was because the monitor showed something was going on, so that was important. But we feel very, very fortunate that we have St. Mary's here and the care that we've been given.
To have that ability to monitor patients that are sitting in a chair or maybe out in our lobby waiting for their test results will be key.
I think they're a life-saving measure. When I wasn't feeling good at home, I came on in and was taken care of immediately. They hooked me up to a monitor, and that's the last thing that I remember, because I understand that they called a code blue on me. It took them 15 minutes to revive me. They had to intubate me. I was out for several days. That's the one thing that I like, is that they have me hooked up to a monitor at all times, because if they didn't, I wouldn't be here talking to you right now.
The cardiac monitors are part of the technology that has been growing with time. The better cardiac monitors, the newer cardiac monitors, are fast and more sensitive, and they can provide us very, very useful information in a more timely manner.
It gives us a better overall picture of what their status is, so we're able to monitor more of their vital signs and do it more efficiently.
There are some patients that come in, may not appear sick, and their condition could change. So detecting that change is important, and monitoring them appropriately is key.
I would strongly encourage my colleagues, the staff members, as well as the community leaders and community members to help us get the new monitors, because that will improve the level of care for the patients.
This is an amazing thing that we're doing for this community. A lot of people need care really, really quickly. We need the monitors to be able to take excellent care of these patients that are walking in the door and prevent them from having the need to go down the hill. We want to keep them close to their family and keep them in the community and serve them here. And we're doing that with our STEMI, our stroke program, and I'm very, very proud of that. So thanks for you guys too for all the help that you're doing so that we can serve this community. We really do appreciate it.